Radiology, Dr. Zach.
Hey, Dr. Zach.
Pleasure to meet you. Be checking out some of the vessels in your upper extremity today. First thing I'll do is I'll have you just sit nice and relaxed. I'm going to check on the skin all the way from the fingertips all the way up to the axilla, making sure there's a nice even color. If I notice any swelling, any edema, maybe cuts, any changes in skin color, moles, hair patterns, just checking things out side to side. I'll check the lips, checking for any signs of cyanosis, checking fingertips, looking for any clubbing, any discoloration of the fingernails on either hand. I'll then check for capillary refill by pressing on the capillaries bilaterally, making sure they fill back quickly, which they are doing. Next thing I'm going to do is I'm going to palpate for pulses. So I'll take, can you put your hand like that on, you can just rest it there. First one I'll do, I'll use a 3-finger contact to get a nice broad contact. I can be more specific if I need to. Find the radial pulse, looking at the rate, rhythm, amplitude, if anything might be different in there. Good. Come over to the ulnar side, feeling for the ulnar artery. 3 fingers again. Checking for the same rate, rhythm, amplitude. And then moving on up to the brachial artery. Again, checking the rate, rhythm, amplitude on my patient. And last thing I'll do is Allen's test. So I could have you bring your arm up like that for me. I'm going to lightly occlude the radial and ulnar arteries. Could you clench your fist for me? I'm going to squeeze hard, bring the hand down. Let go, open your hand. It should refill. Good. And we'll test the other one. So bring it back up. Okay, make a fist for me. Good. Come on down, open up your hand. And the refill looks good on that one as well. Lastly, what we'll do is we'll check the lymph nodes. So I'm going to do epitrochlear, bringing the patient's arm up to 90. Let me know if you have any pain or tenderness, and I'm feeling for any swelling or lumps. Very good. Next, I'll come up and do the apical, just below the clavicle, the anterior on the lateral pec. If it was a female patient, I would make sure to set up boundaries so I'm not violating anything. So the anterior node there, coming up under just on the inside of the humerus, the lateral, the medial, straight into the axilla, and then the posterior, going a little more posterior on the subscapular. And no swelling or tenderness was noted today. And that should do it.